Hello everyone, my name is Kainat Rafiq. I am a registered and a post-study BSN nurse. So today I'm going to discuss about dengue fever, which has been very common nowadays. So let's just start.
So, dengue is a viral infection which is caused by a virus, and that is represented by DENV, that belongs to the family of Flaviviridae. So, Flaviviridae exist in many other genotypes, but there are four genotypes which are involved in dengue fever, and they are DEN1, DEN2, DEN3, and DEN4. And these flaviviruses gonna produce dengue fever through a female mosquito, and this belongs to the species of Aedes aegypti. And as you can see, this mosquito is darkened in color and it has white patches over his legs and body. So once a person has been bitten from a mosquito bite, he goes through three phases, and which are febrile phase, critical phase, and recovery phase. First, we will go with febrile phase. So, it usually begins at about 4th to 7th day, and the symptoms are hyperthermia, which is above 38.5 degrees centigrade, and headaches, myalgia, fatigue, and general weakness. And other than this, nausea, vomiting, diarrhea, abdomen pain, retroorbital pain, and lymphadenopathy because it attacks your immune system, so that is why. And the liver is involved, so you might see hepatomegaly in some patients. Also, you will see macropapillary rashes in some patients, as you can see this picture. And some respiratory symptoms are also involved, such as cough, sore throat, and congestion. And thrombocytopenia is very common in this because bone marrow is involved. So you will have leukopenia and thrombocytopenia. Leukopenia is less white blood cells than normal, and thrombocytopenia is less platelets than normal. Further moving to the critical phase, which you might not see in some patients, but they are bleeding, epistaxis, hematemesis, and gingivitis, which are due to low platelets. And this is called as dengue hemorrhagic fever. And the second one is vascular leakage. The plasma is leaking due to the increase in capillary permeability, so that will cause shock and hypotension. And this is called as dengue shock syndrome. So these symptoms are present in critical phase, which you might see or might not see in some patients. Now moving forward to the recovery phase, in which you're healing up, you're coming up to the normal, but you still have fatigue, mild rash, but you're vitally stabilizing. So these are the symptoms you will have once you have dengue, but most people recovers after about a week. Now we will talk about treatment. So treatment is nothing much we can do except supportive treatment. So you have to take plenty of water. You need to stay hydrated. You have to take 3 liters per day, and it's about 12 cups per day. Avoid NSAIDs. Non-steroids anti-inflammatory drugs should be avoided. You can have paracetamol for your fever and headaches. So you should take rest and stay hydrated and seek medical advice according to the clinical manifestations. So furthermore, you can add is coconut water, which is loaded with electrolytes and vital nutrients. You can also have turmeric because this is antiseptic and metabolic booster. Many doctors suggest turmeric with milk. You can also have fenugreek seeds because they act as mild tranquilizers, and you need to avoid oily food because this contains fats, so this will weaken your immune system. Also avoid spicy food because that will collect acid in your stomach, so you will have ulcers and your body will end up fighting double at the same time. So to prevent from getting bite and mosquitoes, you need to have proper disposing of solid and cleaning and covering of domestic water storage. This is very important. Wear full sleeves and trousers for your personal protection. That will prevent you from getting bite. And stay safe and stay healthy. Thank you.